السلام عليكم ورحمة الله وبركاته طلاب. محاضرتنا اليوم اللي راح أحكيها على الهستامين and antihistamines. So histamine is composed of two words. Histone, which means tissue, is a chemical messenger that mediates a wide range of cellular response. This includes allergic and inflammatory reaction, gastric acid secretion, and neurotransmission in part of the brain. Usually histamine, it's found almost in all tissues. However, they have different distribution, or it's unevenly distributed, with high amount found in lung, skin, and gastrointestinal tracts. It's also found at high concentration in mast cells or basophils, and this explains response to allergic reaction. Histamine also occurs as a component of venom and in secretion from insect sting, where the histidine converted to histamine by histidine decarboxylase. However, histamine in mast cell is stored in granules as an active complex. And if it's not stored, it's rapidly inactivated by amino oxidase enzymes. But how about the release of histamine? We mentioned it's distributed almost all over the body in different tissues. What's the factor that triggers histamine release? This could be classified into two factors: immunological release, where IgE antibodies, immunoglobulin E antibodies. So histamine release by this mechanism is a mediator in immediate type 1 of allergic reactions. And this is the common. Chemical and mechanical release by certain amines in included drugs, such as morphine, tubocuronium, and vancomycin. Histamine effects occur by binding to one or more of four types of histamine receptors, which is either H1, H2, H3, and H4 receptors. H1 and H2 receptors, they are widely expressed, and they are target for clinically useful drugs. For example, antiemetics, anti-allergic, some of them used as second adjunct in peptic ulcer with proton pump inhibitors. Histamine promotes vasodilation mediated by H1 receptors and gastric excretion by H2 receptors. So here, summary of receptor subtypes, distribution, and post-receptor mechanism. For example, it shows that H1 receptors distribute in smooth muscle, endothelium, and the brain. H2 receptors is distributed in gastric mucosa, cardiac muscle, mast cells, and the brain also. So post-receptor mechanism, as you can see, for example, for H1 is triggered GQ and increase IP3 and DAG. And for H2, we can see the trigger of G5 and increase cyclic AMP. For H3, it's distributed in presynaptic autoreceptors and heteroreceptors, brain, ventricular plexus, and other neurons. Post-receptor mechanism so include G1 and decrease in cyclic AMP. H4 is eosinophil, neutrophil, CD4 T cells, where we can see the post-receptors mechanism G1 with decreased cyclic AMP. What's the effect of histamine on organs or in different systems? So first, a nervous system stimulate of sensory nerve endings, especially those mediated pain and itching. For cardiovascular system, injection of histamine cause a decrease in systolic and diastolic blood pressure and an increase in heart rate. Histamine-induced edema by H1 effect, while direct cardiac effect usually are mediated by H2 receptors. Bronchial smooth muscles cause bronchoconstriction, this mediated by H1 receptor specifically. Gastrointestinal smooth muscles, where it causes contraction of intestinal smooth muscles. And its effect on secretory tissues, it stimulates gastric acid secretion by activation of H2 receptors. And it has metabolic effect, where recent studies show that H3 receptors specifically demonstrate result in increased food intake and decreased energy expenditure and obesity when they are absent. For histamine, we can see what's called triple response. So as a result of intradermal injection of histamine cause a characteristic redness, where dilation of small vessels and edema. So this as a result of extravasation of fluid and the flare axon presented by axon reflex response. And this you can practice easily at home. For example, when you have any scratch, you can look at your hand or any part of your body so you can see clearly the presentation of triple response. So clinical use for antihistamine in pulmonary functional laboratories, histamine aerosol has been used as proactive test of bronchial hyperreactivity. Beta-histine is used for manner disease, where increased blood supply to the inner ear. So this for test applications. However, we are generally interested in histamine antagonism. So we understand that histamine can promote allergic reactions and can increase gastric acid secretion. We don't need to see that. In opposite, we should benefit from antagonism of this mediator. This group was, we call this group as antihistamine antagonism or antihistamine drugs. We have H1 receptor antagonist. So this group of drugs subclassified into two categories: first generation and second generation. For first generation antihistamine or H1 antagonist drugs, we have carbonoxamine, diphenhydramine, hydroxyzine, cyclazine, meclazine, chlorpheniramine, promethazine, and cyproheptadines. I do believe many of you, you might use some of them, or you heard from them or use them at home, for example, for allergic reaction, to counteract the allergic reactions. So diphenhydramine, what's called the alarmine, is commonly used for allergic rhinitis. Cyclazine as well, meclazine, chlorpheniramine is used also, and cyproheptadine is used to counteract the allergic reaction, and we can benefit also from its appetite increments. Second generation, they are developed to have better characteristic compared to first generation or first group. This includes terfenadine, esomazole, fixontadine, loratadine, strazine, levostrazine, and desolardine. Again, this group was developed to overcome or to increase the specificity which have been observed in first generation antihistamines. So what's the difference, or what is the advantage of this group? So first generation characterized by strong sedative effects. So they can induce hypnosis. More likely to block autonomic receptors. Has a high distribution into the central nervous system. They can easily pass blood-brain barrier. Less metabolized by CYP3A4 system with less interaction with other drugs, including ketoconazole, the antifungal drugs. This is very important in drug interaction. So any drugs that doesn't interfere with metabolism, it be of favor for clinical use. They have less duration of action, with exception of meclazine, which seem to be with long duration of effect. So what's the effect or the action can be caused by histamine receptor blockage? Sedation, which is considered a common effect of first generation H1 antagonist, alarmine, diphenhydramine, chlorpheniramine, cyproheptadine, promethazine, all of this. Whenever you take diphenhydramine, so you will feel a sedation. And for that, they cannot be used when you are driving, for example. And in case in your case, you are students, so if you have allergic rhinitis, it's more reasonably to have loratadine instead of diphenhydramine, because you don't like to have any substance that interfere with your normal activity. Anti-nausea and emit effect, especially with doxylamine. Anti-Parkinson effect, especially diphenhydramine. Anticholinergic action, this seen with first generation agents, diphenhydramine, chlorpheniramine, meclaz, cyproheptadine, promethazine. Adrenoreceptor blocking action, this also seen with the promethazine. Serotonin blockage action, this notably by cyproheptadine. That's why I mentioned earlier, this promote appetite or enhance appetites, and commonly used to increase appetite in children or people who lose their appetite or they lose their tendency to food. Local anesthesia by block sodium channel. So diphenhydramine and bromethazine are actually more potent than procaine as a local anesthetic due to their local anesthetic effect. However, there are many actions. Cetirizine inhibits mast cell release of histamine and some other mediators of inflammation. And this related to mast cell stabilizing effect. Generally, antihistamine, they can be used to counteract the allergic reaction. This includes allergic rhinitis, urticaria, angioedema, atopic dermatitis, or contact dermatitis. However, you need to decide which one drug is of favor according to the patient situation and condition. And you need to put in mind the advantage of second generation over the first generation when you prescribe such drugs. And you need to consider also the interaction for some of them. Motion sickness and visceral disturbance, especially diphenhydramine and bromethazine. It also can be used for nausea and vomiting of pregnancy. This includes meclizine and doxylamine. Drug interaction for this group include lethal ventricular arrhythmia occurred when terfenadine or estimazole combined with cotonazole or macrolide antibiotics. This, as we mentioned earlier, because they interfere with the metabolism, which is mediated by inhibition CYP3A4 system. Also, grapefruit is found to inhibit CYP3A4 and has been shown to increase terfenadine blood levels significantly. Concurrent use of other drugs that cause central nervous system depression produce additive effects, and is contraindicated while driving or operating machinery. This is all about our lecture for today, and hope it